Hello everyone, welcome to my YouTube channel. So today we are going to be talking about something very vital. Okay, my name is Dr. Emmanuel Ogbodo. I've been working in the UK as a specialty biomedical scientist, and I'm also a lecturer in biomedical science. So let's get into it. Now today we are going to be looking at von Willebrand. Okay, now I think I should just start by saying whenever we talk about coagulation, there are a few things we are likely to look at in coagulation. Okay, obviously von Willebrand has to do with the coagulation, but I want you to know that in coagulation there are a few things that is likely to happen. The question is, do we have sufficient clotting factors, or is there any problem with the clotting factors? Is the system clotting the way it's supposed to clot when necessary, or is there any abnormal clot, or is there any abnormal bleeding because of the problem with either clotting factor or any condition? These are the general things you are going to be seeing when it comes to coagulation. So each of the conditions may vary. Okay, like I think the last one I did discuss about DIC. So today we're going to be looking at von Willebrand. So in von Willebrand, because this von Willebrand is a little bit close, okay, but there's a difference between this von Willebrand and hemophilia. So when I get to that point, I'm going to try to differentiate it for you guys, okay? So when we talk about von Willebrand, we are talking about inherited bleeding disorder. Remember that in hemophilia, that was what we said as well, okay? But I'm going to tell you the difference. So when we talk about von Willebrand disease, we're looking at inherited bleeding disorder. Now, what happened here is that there are several clotting factors, which von Willebrand factors is one of them. Okay, remember when we talk about the clotting factors, we have intrinsic clotting factors, we have extrinsic clotting factors, we have common way clotting factors. Of course, von Willebrand factor is also part of a clotting factors. Okay, so what then happen if there's any problem with this von Willebrand clotting factors? That can have an effect, and that effect it will have is what we then call von Willebrand disease. Now, like I think at this point, I'm not able to try to differentiate hemophilia from von Willebrand. Remember, when we talk about the hemophilia, we linked that disease of hemophilia. You know, when we talk about hemophilia A and B, we linked it with X chromosome. Okay. Then what happened that is why with hemophilia is likely to affect men more, and I did explain that when I was talking about hemophilia. So if you've not watched my video on hemophilia, you can watch it. But when it comes to von Willebrand, it's not significantly about men. Okay, it can affect men, it can also affect women, unlike that of the hemophilia that is mainly going to affect men, unlike the women. But in von Willebrand, it can affect both men and women. Okay, because even though it is an inherited disorder, it has nothing to do with either X or maybe Y chromosome, as the case may be. So that is why it can affect both men and women. Okay, so once again, von Willebrand disease is an inherited bleeding disorder, and it is an inherited bleeding disorder because the von Willebrand factor is either absent, meaning is not present, or the von Willebrand factor is present but it is not functioning very well, or von Willebrand factor is insufficient or low. Okay, now what I want you guys to know that for clot, when somebody is bleeding, for clot to be able to form, so von Willebrand will bind with the factor 8, and following the binding with the factor 8, it can now attach itself with the platelet. So, and its attachment with the platelet is what that will now lead to platelet plug. So, meaning that this von Willebrand factor plays a major role in the stickability for the red blood cell to be able to stick together firmly. Okay, that which is a clot. The von Willebrand factor plays a major role in ensuring that is successfully done. You see it now, and that is why when there's a low or absent, or maybe if the von Willebrand factor is not functioning very well, that is why that sticking property or that plugging property that it helped platelet to form will be difficult in forming, and that can now lead to excessive bleeding. So for blood to successfully clot, what is going to happen that the von Willebrand factor will bind with the factor 8. In fact, I think it's been reported that von Willebrand factor protects factor 8. Okay, so it will bind with the factor 8, and following the binding is also able to stick itself with a platelet. So when it also stick with the platelet, that is why it's able to form platelet plug. Okay, and this can happen in the blood vessel anyway. When we talk about platelet aggregate, okay, when the platelet aggregate to try to stop that, so with the help of the von Willebrand factor, then what is going to happen in the clotting process, then the von Willebrand factor help to make sure that that the red blood cells are stick together firmly. Okay, that is a plug. So that plug that forms is called platelet plug, but Van Willebrand factor is the one plays a major role in making sure that that plug is formed successfully. Okay, so let me repeat that again. So Van Willebrand factor will then bind with the factor 8, and following that as well will bind with the platelet, and in that binding of the platelet, it can now help to encourage platelet plug, and that is because these Van Willebrand factors make the red blood cells to stick together. Okay, so that sticking that it causes the red blood cell to stick together, that is now what we call platelet plug. Okay, and this platelet plug, of course, like you know, can only occur if there's a bleeding. So once there's a bleeding, so during the clotting process, so this platelet plug forms. So what then happen, like I've said already, okay, what then happen if there is a Van Willebrand disease? What do you think that will happen? So you find out that platelet plug, because Van Willebrand factor plays a major role in that platelet plug, that will become very challenging, because if there's a Van Willebrand disease, which I've said is either there is insufficient Van Willebrand factor, or maybe the Van Willebrand factor is not functioning, okay, or maybe there is a absence of Van Willebrand factor. So any of this then will negatively affect the formation of the platelet plug. And if the formation of the platelet plug is not successful, that means the person will continue to bleed. You see the problem now? Okay, now what are the symptoms? So remember then, because the factor Van Willebrand factor plays a major role, and because if it is insufficient, if it is not present, okay, or maybe if it is not functioning while it is there, that platelet plug will not be able to form and will not form successfully. And if the platelet plug cannot form successfully, or there's a struggle in the formation of that very platelet plug-in, and it takes that very platelet plug to stop the bleed, you see it now. So because of that, there's going to be bleeding, and that is why there are signs and symptoms of Van Willebrand. The signs and symptoms of Van Willebrand disease include nose bleeding. So once there's a nose bleeding, maybe more than 10 minutes, the nose, there's a bleeding going on from the nose, and it is more than 10 minutes, you might be looking at something like Van Willebrand disease. Remember that we also mentioned about bleeding and bruises and all of that in hemophilia, okay? So, but anyway, I'm also trying to tell you that when I make this video, I try to connect it to what I've said already in the past. So most of the symptoms here is also common with hemophilia. Okay, so number one, I've mentioned there's going to be a bleeding from the nose. Number two, if there's any little cut from your skin, the bleeding will continue as well. Like I've said when I was talking about the nose bleeding, the bleeding might occur more than 10 minutes. Okay, then of course there is going to be bruises. Okay, of the person who experience bruising, the bruising will be very easily to occur. So there's going to be bruises. Okay, so when you see someone's skin, there's a lot of bruises, it can be a sign of Van Willebrand disease. And of course, remember, we also mentioned that when we talked about hemophilia. And because of that bleeding, what do you think that will happen? Remember that when somebody is losing blood, the person is losing iron, because remember that inside the red blood cells or the blood, there's red blood cell, and that red blood cell contains hemoglobin. And in that hemoglobin, you have heme and you have globin. The heme is where the ions are. So in other words, when the person is bleeding, the person is going to lose a lot of iron. Therefore, there can be iron deficiency anemia. You see it now. Of course, there's going to be a heavy bleeding during surgery, whether it is a dental surgery, okay? So there's going to be a heavy bleeding during surgery because of what? Again, that's dysfunction of Van Willebrand factor, or low Van Willebrand factor, or maybe the absence of Van Willebrand factor, which can then have a negative impact on the formation of the platelet plug. And that is why during surgery, anyone that has Van Willebrand disease is likely to bleed more. There's going to be a heavy bleeding, okay? And this heavy bleeding, of course, can also be associated in terms of maybe in a case of miscarriage, as the case may be. So anything that has to do with the bleeding with the Van Willebrand disease is going to happen severely, because that very Van Willebrand factor is not functioning very well, or maybe not efficient or something like that, and because of that the platelet plug is not able to form. Remember, there cannot be, for plug to form, there has to be a platelet plug. And if Van Willebrand factor helps in the platelet plug, it means that if there's any negative effect, if there's any negative impact on the Van Willebrand factor, it will affect the platelet plug. And of course, when it affects it, it will now encourage bleeding. Okay, I would like to mention that there are different types of Van Willebrand disease. Okay, we have type 1 Van Willebrand disease, we have type 2, we have type 3. In fact, in each of these types, you can have subtypes. For an example, you can have type 1C. Then you can have type 2A, type 2B. In type 1 Van Willebrand disease, what happened is that there is low level of Van Willebrand factor. So in type 1, there's a low level or insufficient amount of Van Willebrand factor. So once there's that insufficient amount of Van Willebrand factor, that means even though the plug is likely to occur, but it might take longer for that plug to occur. Of course, there's still going to be bleeding before it will not take time for the plug to now occur. Remember, what I want you to have in your mind as we talk about this very Van Willebrand is the platelet plug. So they play a major role in the formation of the platelet plug. Okay, so that is why it's a bleeding disorder. So if there's any problem with it, maybe because of genetic mutation and so on, that will now lead to either maybe low Van Willebrand factors. Once it is a low amount of Van Willebrand factor or insufficient amount of the Van Willebrand factor, that is called type 1 Van Willebrand disease. In type 2 Van Willebrand disease, what then happens is that there's nothing, when it comes to the amount of the Van Willebrand factor, it is sufficient. There's adequate amount of the Van Willebrand factor, but unfortunately, they are not functioning. They are not performing they are not carrying out their function. So it is unfunctional. That means it's not active. So once you have Van Willebrand factor, even though it is adequate, even though the amount is normal, but they are not functioning, that will now lead to type 2 Van Willebrand disease. And I've mentioned there are subtypes of type 2 Van Willebrand disease. So you can have type 2A, you can have type 2B, you can have type M, you can have type N. Each of these very subtypes plays a major role in some of the things that you're going to see when you carry out maybe APTT or PT and so on, okay? But for now, I want us to focus on the fact that the Van Willebrand plays a major role in the platelet plug formation. And if there's any negative impact on them, it will affect the platelet plug formation, and of course, that will lead to bleeding, okay? Now, when you talk about type 3, in type 3, what has happened is that there is absence of Van Willebrand factor, okay? So meaning that the Van Willebrand factor due to the mutation is not even there at all. And of course, once it is not there, it's also going to have a negative impact on the platelet plug formation. Then another thing that can happen as well, in some cases, there's also what we call acquired Van Willebrand disease. With acquired Van Willebrand disease, that's where you can now have maybe due to autoimmune disease, okay, autoimmune disease, and that is where you can get lupus, you can get heart diseases, you can get something like maybe when patient like cancer patient as well, that may lead to the acquired Van Willebrand disease, okay? So meaning that condition, okay, is as maybe the person there was not any mutation, but because of in life, maybe due to the condition that the person find himself or herself, then develop, this bleeding disorder. That is called acquired Van Willebrand disease. So I've mentioned like 4 types now. I would say type 1, type 2, type 3, and this acquired Van Willebrand disease. Okay? Now, what are the features that you can see in Van Willebrand disease? When we talk about the laboratory features, so what are the likely features? In laboratory features, you are going to investigate the Van Willebrand test. Under the Van Willebrand test, you're going to have Van Willebrand Antigen, okay? You're going to have Van Willebrand factor, Van Willebrand Ristocetin. Then, of course, you also have to investigate APTT, okay? You also investigate PT-INR, of course. You also then investigate Fibrinogen. You also investigate platelet count. You also investigate something like full blood count, of course, where there will be platelet count, okay? Then you also look at the blood film morphology as well, okay? So these are the things that you might also, these are some laboratory features, that you might need to look at when trying to investigate Van Willebrand disease. So what is going to be the result? For example, before you can now talk about the result, there are obvious things, okay? Each of these very laboratory tests, there are obvious things that you know that you're going to see. For example, there will be anemia, okay? Once you know that it's a Van Willebrand disease, that means there's a bleeding disorder. And if there's a bleeding disorder, this person is losing blood. And if the person is losing blood, the person, of course, is losing iron. And if the person is losing iron, there's going to be iron deficiency anemia. At least that's number one thing that you're going to see. So meaning that when you do the full blood count, you're likely to see low red blood cell, low hematocrit, low hemoglobin. And of course, the MCV now is likely to be low as well, because low MCV is associated with iron deficiency anemia. Does that make sense? So that is what you can see in full blood count. And of course, when you talk about the platelet count, and because of that bleeding and nothing, the platelet plugging is not forming, the platelet count might be normal, and in some cases the platelet count may be low as well. So it varies from the type of the Van Willebrand that is occurring. Remember, I mentioned when we talk about Van Willebrand disease, we're looking at type 1, type 2, type 3, and acquired. Then I said each of these types, they have subtypes as well. So whether the platelet count is going to be low or is going to be normal, okay, but significantly most of them are likely to be normal. When the platelet count is low, it depends on the type of the Van Willebrand disease. Now, what are you likely to see? You are likely to see, remember, depending on the type of the Van Willebrand anyway, so you are likely to see low Van Willebrand factors. You might likely to see low, high, or absence of Van Willebrand Ristocetin. When it comes to Van Willebrand antigen, it can be normal, it can be low, again, depending on the type, okay? Then when it comes to the APTT, it can be low, it can be normal, again, depending on the type. But what happens with that of the APTT, of course, is significantly when it is maybe factor 8 is affected. But when it comes to PTR now, most times it's likely to be normal, but in some cases, of course, it might still be low, okay? Then, of course, fibrinogen might be normal because for clot to form, remember, for clot to form, that means fibrinogen needs to be converted to fibrin. And if there's no Van Willebrand factors helping in that very clot formation, fibrinogen is going to be there, not being used. So that means it will be normal, okay, in most cases. Then when you look at the blood film morphology, you are likely to see features of anemia, and of course, in some cases, you might see thrombocytopenia, or maybe it might be normal, again, depending on the situation. So now, depending on the type. So now let us look into that types very well. But what I want you to know, because if you go for interview, you may not be mentioning the types. So the types is just for you to have an idea. When you want to mention Van Willebrand in terms of the things we are discussing now, maybe in terms of race APTT or race PTR now, or maybe whatever, low platelet count and so on, always refer in things like APTT, PT, platelet count, that it depends on the type of the Van Willebrand disease, okay? So when it comes to Van Willebrand factor, type 1, type 2A, type 2B, and type 3, they are going to be low. You are going to have low Van Willebrand factor. When you talk about Van Willebrand antigen, type 1 will be low, type 2A will be normal or slightly reduced, and type 2B will also be normal or slightly reduced, okay, depending on the level or severity of the condition. Type 3 will be very low, or it will not be there, it will not be present. In other words, when you measure Van Willebrand antigen, when it is type 3 Van Willebrand disease, okay, that antigen, the Van Willebrand antigen, is likely to be low or will be absent. In terms of the platelet count, like I've said, depending on the condition, but significantly, most of them are likely to be normal except type 2B. So in platelet count, both type 1, type 2A, and type 3, the platelet count is likely to be normal, but type 2B is likely to be low, the platelet count. Now, when you talk about PTR or PT, as the case may be, the type 1 may be normal or slightly prolonged, while type 2 will be normal, type 2A, of course, will be normal, type 2B will be normal, but type 3 will be prolonged. So when you talk about PTR or PT, type 1 is going to be normal or slightly prolonged. That means slightly high, while type 2A will be normal, type 2B will be normal, but type 3 is going to be prolonged or high, okay? Now, when we talk about Van Willebrand Ristocetin, in type 1 is going to be decreased, in type 2A is going to be decreased, in type 2B is going to be high, then in type 3, Van Willebrand Ristocetin is going to be absent, okay? I hope that makes sense. And so when we talk about factor 8, remember what I told you guys about Van Willebrand factor, that it's actually been reported that it protects factor 8. So it binds to factor 8, then get to the platelets and so on. So anyway, when we talk about factor 8 activities in Van Willebrand disease, type 1 is going to be mildly low, type 2A is going to be normal, type 2B is going to be normal, type 3 is going to be severely low, okay? So you might get something like less than 5%. So these are so basically, it depends on the types. That is why when you do the APTT in Van Willebrand disease, okay, it might be low, it might be normal. Remember that factor 8 is measured in APTT because APTT measures intrinsic pathway and factor 8 is an intrinsic factor, okay? So therefore, with APTT then, you can get either normal or low, like I've said, depending on the condition, depending on the type. From what I've said from the factor 8, that means APTT is likely to be normal in type 2A and type 2B. And type 1, it might be slightly low, okay, and of course in type 3 is going to be severely low, okay? So most of these very factor assays, like maybe factor 8 assays and other factor assays, you should be looking at something like 50 to 150. But again, if it is a Van Willebrand disease that affects factor 8, you might be looking at something like 30 to 40. I hope that makes sense. Okay, what I'm trying to say here that when it comes to APTT, the same thing with PTRNR. It is not all the type of the Van Willebrand disease that affects the result. Okay, so the result of PTRNR or APTT that is affected when somebody is having Van Willebrand disease depends on the type of the Van Willebrand disease. Okay, so that is for Van Willebrand disease. So what I want to say as a recap is that Van Willebrand disease is a bleeding disorder. Okay, being a bleeding disorder, this can be as a result of genetic mutation and so on. Okay, and this Van Willebrand disease is a bleeding disorder because it has to do with the Van Willebrand factor. The Van Willebrand factor is the main thing. Another thing that also causes is the Van Willebrand antigen. Okay, so once there's a deficiency in Van Willebrand factor, or there is absent in Van Willebrand factor, or there is adequate Van Willebrand factor but they are not functioning, okay, that would then have effect. The contribution of Van Willebrand factors in the bleeding disorder is because of its role in the platelet plug formation. So when they are low or insufficient, or they are normal but they are not functioning well, or it is absent, what is going to happen is that it's going to have a negative impact on the platelet plug formation, and that negative impact means then that the person is likely to bleed, because that platelet plug that would have stopped the bleeding is not going to form the way it's supposed to be formed, and that can have a negative impact. So I hope that makes sense. Now what I'm going to tell you, if you go for your interview, you know that when I started these videos I was telling you guys about race APTT, race PTRNR. So now I want you guys to start learning, of course, when you go for your interview, to start linking whether race APTT, race PTRNR to hemophilia, DIC, and of course this Van Willebrand that I've mentioned now. And of course, remember that this is also have effect when you talk about something like ITP and TTP. I want you guys to start going beyond some of the things that I've said when I mentioned about race PTRNR and race APTT, and start looking at other conditions that could affect those results in addition to the things I had said there. So you could look at it like DIC, you could look at it like hemophilia, you could look at it like Van Willebrand, like I've said now. You can look at it like ITP and TTP and so on. Okay, so anyway, you can go that detail when somebody asks you a question on race APTT or race PTRNR. But whenever it comes to the Van Willebrand factor, please, if you are mentioning it in terms of race PTRNR or race APTT, please stretch the fact that it has to do with the type of that Van Willebrand disease. And of course, remember that when you talk about hemophilia, if you want to mention hemophilia, you might need to consider it more in terms of race APTT. Here you go. This is the few things I want to say about the Van Willebrand disease. Okay, so what I'm going to say that please let me know in the comment section what you think about the video. Put your comment, and of course, if you have any question, of course, also put it there. And please, can I just ask you to like, share, and subscribe. And thank you very much till I come back away again. Bye-bye.